So now we're going to start the discussion about the pectoral muscles, muscles of back, and the muscles around the scapula. Okay, you have to know the attachment for these muscles. First, we discuss the muscle attachment in the bones, and then we see the muscles one by one. Okay, now see the diagram. Now in the diagram, we are seeing the scapula. This is the anterior aspect, and this is the posterior aspect. Now in the scapula, the glenoid cavity, it is the lateral angle that articulates with the head of the humerus and form the shoulder joint. If that is a lateral angle, then the border immediately below that is called lateral border. On the other side, this is a medial border. The medial border receives one muscle. What muscle? Serratus anterior. Okay. The entire medial border receives serratus anterior. Okay. So medial border in the front side, serratus anterior muscle inserted. Serratus anterior. Now medial border on the back side, posterior side, we have three muscles above the spine, just opposite to the spine, and below the spine. So this is spine. Now above the spine, the medial border receives levator scapulae muscle. Levator scapulae muscle. Opposite to the spine, rhomboides minor muscle. Below the spine, rhomboides major muscle. Okay, so this green color is the, I'm writing R small m, and this is R capital M. So R small m is the rhomboides muscle. Rhomboides minor, and another one is rhomboides major. So we have three muscle insertion on the medial border, posterior aspect. Okay, above the spine, levator scapulae muscle. Opposite to the spine, rhomboides minor. Below the spine, middle border. On the back side, this is rhomboides major. Now come to the front aspect. Now this is the anterior surface. The entire anterior surface, that is subscapular fossa, including the lateral border, giving origin to one muscle. Which muscle? Subscapularis muscle. So subscapularis muscle, origin from subscapular fossa. Subscapularis muscle, including lateral border. Okay, so this entire lateral border and the subscapular fossa giving origin to subscapularis muscle. Now lateral border on the back side giving origin to two muscles, teres minor and teres major. Teres minor and teres major. Okay, so lateral border giving origin to two muscles on the back side, teres minor and teres major. Clear? Right. That's all about the borders, lateral border and the medial border. So in the lateral border, only you see muscle insertion. Lateral border is not giving origin to any muscle. Muscles are inserted here. Okay, serratus anterior insertion in the front side. So that's all about the borders. Now, if you see the border, the medial border, it is getting only muscle insertion. Medial border, it is monopoliced by insertion of the muscles. You see only insertion of the muscles in the medial border. Serratus anterior muscle in the front side, back side, levator scapulae, rhomboides minor, rhomboides major. Only muscle insertion you see. Whereas lateral border, only origin. It is monopoliced by only origin of muscles. Okay. In the front side, subscapularis, back side, teres minor, teres major. Fine. Now come to the diagram. Now above the spine, we have a fossa that is called supraspinous fossa. Below the spine, we have a fossa, infraspinous fossa. Okay. So they give origin to corresponding muscle, supraspinatus and infraspinatus. I don't have a space there, so I'm writing here. So supraspinatus and infraspinatus muscle, they take origin from the corresponding fossa. Okay, that is also fine. Next, see the angle, lateral angle. Now, lateral angle, I told you, glenoid cavity is in the lateral angle. Now, above the glenoid cavity, we have a tubercle. Below the cavity, we have a tubercle that is called supraglenoid and infraglenoid tubercle. See, tubercle means round elevation. So we have two tubercles above and below the glenoid cavity. So it is called supraglenoid tubercle and infraglenoid tubercle. Supraglenoid tubercle origin to biceps muscle. Origin to, please remember, long head of biceps. Now, infraglenoid tubercle giving origin to long head of triceps. Origin to long head of triceps. Clear? Right. So, next one. I told you long head of biceps from the supraglenoid tubercle. Okay. What about the short head? The short head is coming from this fellow, coracoid process. Coracoid process giving attachment to three muscles. See the diagram? Now this is our coracoid process. So coracoid process attachment to three muscles. What are those? Mnemonic is PCB, Pakistan Cricket Board, old mnemonic. Now P is our pectoralis minor. C, coracobrachialis. B, biceps, shorted of biceps. So coracoid process receives three muscles, mnemonic PCB, Pakistan Cricket Board, pectoralis minor, coracobrachialis and shorted of biceps. So shorted of biceps from the coracoid process origin, long head of biceps from supraglenoid tubercle. Clear? Right. Now almost over. Now one more process we have, that is our acromion process. Now see the spine. The spine of the scapula. Now see the diagram. Now in the diagram, this is a posterior view. Yes. And we are seeing the spine. This is the spine of the scapula and that is our acromion process. Now acromion process is having two border. This is the medial border and this lateral border. So M is medial and L is lateral border of the acromion process. Okay. Now for the spine of the scapula, we have upper lip, and the lower lip. So spine is having upper lip and the lower lip. Now see the diagram. The upper lip of the spine is continuous with the which border of the acromion process? Medial border. So upper lip of the spine continues with the medial border of the acromion process. Now see the lower lip. The lower lip of the spine which is continuous with the lateral border of the acromion process. Yes or no? Now still not over. We're going to join with the clavicle. Now clavicle, this is the lateral 1/3 of the clavicle. I told you lateral 1/3 is flat. We have anterior border and the posterior border. So this is the anterior border and this is posterior border. So we write clavicle lateral end. So clavicle, the lateral end have anterior border and the posterior border. Having anterior border and posterior border. Right. Now see the diagram. The lateral border of the acromion, okay. The lateral border of the acromion is continuous with the which border of the clavicle? Anterior border. So please write lateral border of the acromion process which is continuous with anterior border of the clavicle, lateral 1/3. Similarly, the medial border of the acromion is continuous with the which border of the clavicle, lateral 1/3? Posterior border. So we have a continuity here. Right. So the medial border of the acromion which continues with the posterior border of the lateral 1/3 of the clavicle. So the medial border of the acromion process continues with the posterior border of lateral 1/3 of the clavicle. The lateral border of the acromion continues with the anterior border. We have to know this line, continue line, because they give origin and insertion. So now we know the continuity. So now we're going to discuss the origin of deltoid. See, deltoid is origin from these fibers. Number 1, number 2 and number 3. 1, 2 and 3. What is number 1? Number 1 is the anterior border of lateral 1/3 of the clavicle. That is giving origin to anterior fibers of deltoid. Middle fibers of deltoid is coming from lateral border of the accumbens process. The posterior fibers of deltoid is coming from the lower lip of the spine of the scapula. This is the origin of deltoid. If you know the continuity, very simple. Okay, right. Now we're going to draw the insertion of trapezius. Again, it's very simple. Already we know the continuity. So the same diagram, I'm going to mark the insertion of trapezius. Trapezius muscle is inserted here. This is number 1, this is number 2, and this is number 3. So what is 1? Number 1, upper border of the spine of the scapula. Number 2, trapezius inserted to medial border of the accumbens process and also to the posterior border of lateral 1/3 of the clavicle. Okay, this is the origin of deltoid and the insertion of trapezius muscle. Right. So that's all about the muscle attachment in the scapula. Now we're going to see the humerus bone. This is the humerus bone too. So now the humerus bone, the upper part we're going to discuss now. The head of the humerus. Immediately below the head of the humerus, we know the surgical neck. Now in the upper part, we have two round elevations. One is called lesser tubercle, another one greater tubercle. Now lesser tubercle, which receives only one muscle, our subscapularis muscle. So lesser tubercle receives only one muscle, subscapularis. Okay, right. Now in the greater tubercle, we have three muscle. The greater tubercle, which receives three muscle. Number 1, supraspinatus. Number 2, infraspinatus, and teres minor. Three muscles attached to the greater tubercle: supraspinatus, infraspinatus, and teres minor. Now see the diagram. Now between the two tubercle, greater and lesser tubercle, we have a sulcus, and that is called intertubercular sulcus. Okay. Now intertubercular sulcus is having, now this is the medial lip of the intertubercular sulcus, and this is the lateral lip of the intertubercular sulcus, and between these two we are having floor. So medial lip, this is the floor, and this is the lateral lip. Okay. Now muscles attached to medial lip, lateral lip, and floor. We have a mnemonic. Mnemonic is the lady between the two major. So medial lip, we have teres major muscle. Okay. What about the lateral lip? Pectoralis major muscle. Now between these two muscle in the floor, latissimus dorsi muscle. So lady between the two major. So medial lip, teres major, lateral lip, pectoralis major, and floor, latissimus dorsi muscle. Okay. Yes. This is muscles attached to the intertubercular sulcus. Now one more muscle attachment you have to know, that is deltoid. Deltoid muscle attached to deltoid tuberosity. It is a tuberosity on the lateral border of the shaft of the humerus. So in the lateral border of the shaft of the humerus, we have deltoid tuberosity, deltoid muscle inserted. Okay, right. So these are the muscle attachment you have to know in the bones. Now we start the discussion about the muscles. Now first we start with the pectoral region. So pectoral region, we have three muscles. Pectoralis major. If you remove the pectoralis major muscle, we have pectoralis minor, and then we also see the serratus anterior muscle. Okay. So first, pectoralis major muscle. So again, no need to know the exact origin point for this muscle. Pectoralis major muscle having origin from number 1, clavicle. Number 2, sternum is here. Sternum and the costal cartilage. Up to 6th costal cartilage, it takes origin, and it also takes origin from here. The external oblique muscle aponeurosis will come. External oblique muscle aponeurosis, and this muscle also takes origin from the aponeurosis. The aponeurosis of external oblique will be here. Attachment will be here. So that is the aponeurosis of external oblique muscle. So just remember these 3 points. That is more than enough for the origin. Origin from clavicle, sternum up to the 6th costal cartilage, and also from aponeurosis of external oblique muscle. Insertion you have to know. Just now I told you, lady between the two major. So lateral lip of the intertubercular sulcus. Nerve supply. Pectoralis major, it is a hybrid muscle supplied by medial and lateral pectoral nerve. Okay, right. Next, what is the action of this muscle? See, if you want to know the action of any muscle, just remember this thing. Origin point, fixed point. Insertion point, move towards the origin point. If you move the muscle fiber towards the origin point, then you will get the action. Now, pectoral is major muscle, origin from the trunk, I'm saying. Sternum, clavicle, okay, appendix, okay. Now, you can call this as a trunk. Okay, this is trunk. I'm putting T here. Insertion to the humerus bone. So, just now I told you, insertion point, move towards origin point. Now, the humerus bone, move towards the trunk. So, what is the action? Humerus bone moving towards the body, moving towards the midline. That is called adduction. So, pectoral is major muscle, adduction of the shoulder joint, number one. Now, while doing adduction, the humerus bone also rotates internally. So, this muscle also do medial rotation. Medial rotation. Again, this muscle is taking origin from the trunk in the front side. Any muscle crossing the joint in the front side, what they do? Flexion. So, pectoral is major muscle having three actions at the level of shoulder joint. What are those? Adduction, medial rotation, and flexion. Any doubt? Origin from the trunk, insertion to humerus. Humerus bone moving towards the body. So, adduction and internal rotation, medial rotation. Plus, it is crossing the shoulder joint in the front side. Flexion. That's all about this muscle. Action very important. They will ask you. Okay. Next. Now we remove the pectoralis major muscle. Now we are seeing pectoralis minor muscle. Pectoralis minor muscle origin from third rib, fourth rib, and the fifth rib. Insertion point. I told you already. Coracoid process. PCB. Insertion to coracoid process. Okay. Now what is the action? Now origin from the trunk. Okay. Insertion to the coracoid process. Coracoid process, scapula. Okay. Now, the scapula bone move towards the trunk. Trunk in the front side, scapula on the back side. So, scapula bone, it is moving towards the trunk, moving towards the rib. Scapula is moving in the front side, moving anteriorly. It is called protrusion. For scapula, we use the term protraction. So, action of pectoralis minor, protraction of the scapula. Protraction of the scapula. That is the action of this muscle. Okay. This protraction of scapula is also done by serratus anterior. That is the main muscle. Serratus anterior, it is a main muscle for protraction. Pectoralis minor is helping the serratus anterior for the protraction of the scapula. Next, nerve supply. Nerve supply again, pectoralis minor is supplied by medial and lateral pectoral nerve. Same nerve. Or pectoralis major and minor. Medial and lateral pectoral nerve. That's all about this muscle. Next, serratus anterior muscle. So this is serratus anterior. So serratus anterior muscle origin from upper 8 ribs by 8 digitations. Insertion, I told you. Which border of the scapula? It goes to medial border of the scapula in the front side. Medial border of the scapula. Okay. Right. Now, again, what is action? Again, origin from the rib, insertion to the scapula. Origin from the trunk, insertion to the scapula. Now, scapula bone is moving in the front side, moving anteriorly. Just now I told you. So, serratus anterior muscle, again, it is doing protraction of the scapula. So, protraction of scapula is done by two muscles. Main muscle, serratus anterior. Helping muscle, pectoralis minor. One more action is there. The serratus anterior is also helping for overhead abduction. Also helping for overhead abduction of the shoulder joint. Now, overhead abduction is mainly done by trapezius muscle. Serratus anterior is a helping muscle for trapezius for overhead abduction of the shoulder joint. So, trapezius is the main muscle. Serratus anterior assists triceps in the overhead abduction of the shoulder joint. Next, what is the nerve supply? Serratus anterior nerve supply by long thoracic nerve. Long thoracic nerve root value C5, C6, C7. Long thoracic nerve also known as nerve of Bell. Yes. Now, injury to long thoracic nerve. So, which in turn result in the palsy of serratus anterior muscle. So, which movement is lost? Serratus anterior is a main muscle for protraction of the scapula. So, protraction of scapula, yes, it is not possible. So, due to unopposed action of the retractors. So, due to unopposed action of retractors, patient have winging of scapula. Okay, yes. So, winging of scapula is due to involvement of which nerve? Long thoracic nerve. Palsy of which muscle? Serratus anterior muscle. Okay, right. So, these are the muscles in the pectoral region. Now, we're going to discuss about one fascia. That fascia is present between clavicle and pectoralis minor. That is called clavipectoral fascia. Name itself we have a clue. Clavipectoral fascia, clavicle and pectoralis minor. Now, first we're going to remove this muscle, pectoralis major muscle. If you remove the pectoralis major muscle in the deep layer, you see this fascia. Now, we're going to draw one cut section diagram. Now, this is our clavicle. So, this is our clavicle. Cut section diagram. Now, below the clavicle, one muscle is taking origin. Which muscle? One muscle is present. That is our subclavius muscle. So, clavicle, I am writing C here. And this is our subclavius muscle. Present just below the clavicle. That is subclavius muscle. Subclavius muscle. Okay. Now, the front side, yes, we have the pectoralis major muscle. So, this is pectoralis major. And we have a fascia over the pectoralis major. Okay. Yes. Now, if you remove the pectoralis major, then the deep layer, we will see the pectoralis minor muscle. So, if you remove the pectoralis major, in the deep layer, we have pectoralis minor. This is pectoralis minor. I told you, between clavicle and pectoralis minor, what we have? Yes, very good. This is our clavipectoral fascia. So, clavipectoral fascia will be like this, coming from here. So, this is our clavipectoral fascia. So, this is our clavipectoral fascia. Now, from this diagram, it is very clear. Clavipectoral fascia is enclosing two muscles. What are those? Number one, subclavius. Very good. Number two, pectoralis minor muscle. This is pectoralis minor. So, our clavipectoral fascia enclose subclavius muscle and pectoralis minor muscle. Fine. Now, after enclosing the pectoralis minor, the clavipectoral fascia, which in turn continue as suspensory ligament of axilla. Which in turn continue as suspensory ligament of axilla. So, suspensory ligament of axilla is derived from clavipectoral fascia. The suspensory ligament, which in turn blends with our axillary fascia. Which in turn blends with axillary fascia. Axillary fascia. Axillary fascia, deep fascia and the axilla. Okay. Right. So, two muscles enclosed by clavipectoral fascia. Now, see the diagram. Yes. The diagram, yes. We are seeing the clavipectoral fascia. So, clavipectoral fascia will be here. Now, there are some structures piercing the clavipectoral fascia. What are those? One artery, one nerve, and one vein. So, three structures piercing the clavipectoral fascia. Artery, thoracoacromial artery. Nerve, lateral pectoral nerve. Vein, cephalic vein. So, the blue color is the cephalic vein. Okay. So, cephalic vein. So, three structures piercing the clavipectoral fascia. So, we write here structures piercing clavipectoral fascia. Clavipectoral fascia. Artery. Which artery? Thoracoacromial artery. Thoracoacromial artery. Vein, cephalic vein. Nerve, lateral pectoral nerve. Lateral pectoral nerve. So, three structures pierce the clavipectoral fascia. Expected question. Okay. Right. So, that's all about the muscles in the pectoral region. Now we're going to see muscles of back. So now we're going to start the discussion about the back muscles. Now in the back, yes, first we're going to discuss about trapezius. Now trapezius muscle, it is triangular in shape. If you take the muscle on one side, the shape is triangular. So it is triangular in shape. Now origin, they won't ask you. Okay, for the completion's sake, I'm writing origin, no need to know. Just remember some basic points. Okay, it is origin from the external occipital protuberance and superior nuchal line, ligamentum nuchae, and the spine of the thoracic vertebra and C7. No need to know the exact origin. Just see the diagram. That is enough. Origin from occiput bone and the thoracic spine. If you know that, more than sufficient. Origin, they won't ask you. Insertion, already we know. Insertion, the trapezius muscle attached to upper lip of the spine of the scapula. Yes, which continues with the which border of the acromion process? Medial border of the acromion process, and that is continue with, very good, posterior border of lateral 1/3 of the clavicle. Yes. Again, origin insertion, usually they won't ask you. The question will be from the actions. Okay. Now, what is the action of the trapezius muscle? So, insertion point, move towards the origin point. So, now these fibers, the scapula, the spine, it is moving towards the origin point like this. So, these fibers, the upper fibers, they move the scapula superiorly. So, scapula is moving superiorly. That is called elevation of the scapula. So, actions, number one, trapezius muscle action, number one, elevation of the scapula. Elevation of the scapula. Along with one muscle is helping. Which muscle? See this muscle. This is our levator scapulae muscle. Levator scapulae muscle also do same movement, will move the scapula superiorly. So, elevation of scapula is done by our trapezius muscle along with levator scapulae muscle. Along with levator scapulae muscle. Next, second action for trapezius. See the diagram. In the diagram, now these fibers. Now these fibers, they move the scapula towards the thoracic spine. See, thoracic spine is the most posterior projecting point. So scapula is moving towards the thoracic spine. That means scapula is moving posteriorly. So what is action? Moving posteriorly. Moving the front side, I told you protrusion or protraction. Moving posteriorly, that is called retraction. So scapula is moving posteriorly, that is called retraction of the scapula. Retraction of the scapula. Okay. Now along with one helping muscle. Along with rhomboides minor. We have two more muscles helping for this movement. That is our rhomboides minor and rhomboides major. Okay. So retraction of scapula done by three muscles: trapezius, rhomboides minor, and rhomboides major. And we know already. Now trapezius muscle also helping for overhead abduction of the shoulder joint. Overhead abduction of the shoulder joint. That is abduction from 90 to 180 degree abduction. Okay. These are the three actions of our trapezius muscle. Now supply. Now supply. Very easy, no? I told you head and neck itself. Spinal part of accessory nerve. So spinal part of accessory nerve, 11th nerve, supplies sternocleidomastoid muscle and trapezius. Yes, very good. Now see the diagram. Now see the other side. Now on the other side, we removed the trapezius muscle and we are seeing levator scapulae, rhomboides minor and rhomboides major. Now levator scapulae muscle, already we know the action. It is a helping muscle for trapezius for, yes, elevation of the scapula. What is the nerve supply? Levator scapulae muscle is the hybrid muscle. It is the hybrid muscle. Two nerve supply. What are those? It is supplied by C3, C4 fiber and also by dorsal scapular nerve. Dorsal scapular nerve. Okay. Now rhomboides minor and rhomboides major, they also supplied by dorsal scapular nerve. Dorsal scapular nerve. So dorsal scapular nerve supplies levator scapulae muscle, rhomboides minor and rhomboides major. Okay, right. Now, after finishing the muscles, now in the back, we have two triangles. One is auscultation triangle and another one is a lumbar triangle. So we're going to zoom this diagram and we're going to see the auscultation triangle. Right. So now we zoomed the diagram. Yes. Now we're going to see triangle of auscultation. So this is the triangle of auscultation. Now this is the medial side for the triangle, lateral side, and this is the base. Medial side, what muscle we have? Trapezius muscle. This is trapezius muscle. Laterally, you are seeing this bone. Which bone? Scapula. Which border? This is the medial border. This is the medial border. I'm writing M here. That is the medial border of the scapula. And in the base, we have latissimus dorsi muscle. Now we're going to write the boundary. So this triangle is called triangle of auscultation. So triangle of auscultation, medially, we have which border of the muscle? Lateral border of trapezius. Lateral border of trapezius. Okay. Laterally, we have scapula bone. The medial border of the scapula bone. Medial border of scapula bone. Base is by which muscle? Latissimus dorsi muscle. Now this is called triangle of auscultation. So triangle of auscultation, if you put a stud here, then you will see the apex of the lower lobe of the lungs. You can auscultate the sounds from the apex of the lower lobe of the lung sounds can be heard through this triangle. Okay, yes, this triangle of auscultation. Now we have one more triangle that is called lumbar triangle of Pitti. Lumbar triangle of Pitti boundaries, this is the front side, anterior, this is the back side, posterior, and this is base. So lumbar triangle of Pitti, anterior side, anteriorly we have one muscle. Which muscle? External oblique muscle. So anteriorly, external oblique muscle. Okay, posteriorly, muscle again. Which muscle? Latissimus dorsi muscle. And the base is formed by iliac crest. Base is formed by iliac crest. Now what is the importance of this triangle? Now this triangle contains no content. It is a potential site for internal hernia. That's all. No content. So potential area, potential site for the internal hernia. That's all. So these two triangles you have to note. Okay. And that's all about the muscles of back. Next, we're going to see the muscles around the scapular region. The muscles around the scapular region. First, we're going to see deltoid muscle. Okay. So deltoid muscle origin, I told you already, origin from the anterior border of lateral 1/3 of the clavicle, okay, which is continuous with the lateral border of acromion process, which is continuous with the lower lip of the spine of the scapula. So deltoid muscle origin from these three bones. Now the fiber arising from the clavicle, this is anterior fiber. The fiber arising from acromion, middle fiber. From the spine of the scapula, posterior fiber. So anterior fibers are deltoid coming from anterior border of lateral 1/3 of clavicle. Middle fibers are deltoid coming from lateral border of the acromion process. And the lower lip of the spine give origin to posterior fibers of deltoid. So now insertion of deltoid muscle, we know already we have tuberosity in the lateral border of the shaft of the femoris, that is called deltoid tuberosity. So deltoid tuberosity receives deltoid muscle, very simple. Okay, insertion to deltoid tuberosity. Okay, what is the nerve supply? Nerve supply, axillary nerve. Axillary nerve supplies only, yes, two muscles, deltoid and teres minor. Now, what is the action of deltoid muscle? I told you we have three fiber, anterior fiber, posterior fiber, and middle fiber. Now, anterior fiber crossing the shoulder joint in the front side. So, what the anterior fiber will do? Anterior fiber, flexion of the shoulder joint. Anterior fiber, flex the shoulder joint. Okay, what about the posterior fibers? Posterior fibers crossing the joint at the back side, so they extend the shoulder joint. Okay, what about the middle fiber? Middle fiber, which move the humerus bone laterally to move the humerus bone away from the body, that is called abduction. Moving away from the body, abduction of shoulder joint, again from 15 to 90-degree abduction done by middle fibers of deltoid or acromion fibers of deltoid. Okay, right. So these are the points you have to know about the deltoid. Next, now we want to see, if you remove the deltoid muscle, then under the cover of deltoid, we see some more muscles. Okay, so we're going to zoom this image and we're going to see the muscles under the cover of deltoid. So now on the other side, we remove the deltoid muscle, so that we are seeing now this muscle present above the spine, that is called supraspinatus muscle. Now this muscle is present below the spine of the scapula. So I am writing IS, infraspinatus muscle. IS means infraspinatus. This one. And below that, we are seeing teres minor muscle. This is teres minor muscle. Now first, supraspinatus muscle. Okay. So supraspinatus muscle origin from supraspinous fossa. Okay. Now what about the insertion? Origin from the supraspinous fossa. Fine. What about the insertion? I told you. Inserted to tubercle. Greater tubercle. Greater tubercle receives three muscles: supraspinatus, infraspinatus, and teres minor. So insertion, greater tubercle. Okay. Now what about the action? Action of the supraspinatus muscle, very important. Continuously 3 years in the FMG exam, we got this question. Okay. So insertion, this is our tubercle, greater tubercle. Okay. Now the tubercle is moving towards the origin point like this, attached to greater tubercle here. Now the tubercle is moving towards origin point like this. So tubercle is moving away from the body. That means the humerus bone is moving away from the body. Moving away from the body, moving away from the midline. So what is action? Supraspinatus muscle, abduction of shoulder joint. Supraspinatus muscle do abduction of the shoulder joint. Abduction of the shoulder joint. Now please remember, this muscle initiate the abduction of shoulder joint. How much degrees, sir? 0 to 15-degree abduction is done by this muscle. So supraspinatus muscle initiate the abduction from 0 to 15 degree, only up to 15 degree. After 15 degree, the middle fibers of delta will take over. Up to 90 degree. After 90 degree, trapezius and serratus anterior will take over. So abduction of shoulder joint is very important. So now we can put one box and we can write abduction of shoulder joint. Now itself, abduction of shoulder joint. So 0 to 15-degree abduction is done by, yes, very good, supraspinatus muscle. Okay. 15 to 90-degree abduction is done by middle fibers of deltoid. Middle fibers of deltoid. Fine. 90 to 180-degree abduction is done by our trapezius and serratus anterior. Okay. Right. Very important. They may ask you specifically. Right. So now, nerve supply. Supraspinatus muscle, infraspinatus muscle, they are supplied by suprascapular nerve. Suprascapular nerve supplies supraspinatus and infraspinatus. Now, next, we're going to discuss about the infraspinatus muscle. So now, next muscle, this is our infraspinatus muscle. So infraspinatus muscle origin from the infraspinous fossa. Infraspinatus muscle origin from the same fossa, infraspinatus fossa, insertion to the same tubercle, greater tubercle. Okay. Now what is the action? That is very important. Now the action of infraspinatus muscle, now attached to the greater tubercle here on the back side, posterior and lateral. Okay. So now the tubercle is rotating, moving towards the origin point like this. So tubercle try to meet the origin point like this. Is it clear? attaching to the humerus bone, tubercle, on the back side and lateral side. So tubercle is rotating externally. Now we have one more muscle just below the infraspinatus muscle. We have teres minor muscle. This is teres minor. Again, teres minor muscle insertion to the same tubercle, just little below the infraspinatus muscle. What this muscle will do? Same. The tubercle rotates posteriorly. The tubercle rotates laterally to meet the origin point. Tubercle rotating externally. So we have two muscles for this movement. What movement? Lateral rotation. Lateral rotation is done by two muscles. Lateral rotation of the shoulder joint is done by two muscles. What are those? One is our infraspinatus muscle and another one is teres minor. So infraspinatus and teres minor, they do lateral rotation of the shoulder joint. Okay. Infraspinatus, supraspinatus, what is the nerve supply? Suprascapular nerve. Already told, suprascapular nerve. Okay. Teres minor nerve supply. Just now I told you, axillary nerve. Okay. Right. So that's all about the muscles attached to greater tubercle, supraspinatus, infraspinatus, and teres minor. Next, we're going to see subscapularis muscle. So subscapularis muscle origin from the subscapular fossa. Very simple. Yes, very good. What about the insertion? Insertion to one small tubercle, lesser tubercle. Lesser tubercle. Okay. Now, what is the action of this muscle? Action of subscapularis muscle. Now, the origin point from the subscapular fossa in the front side, attached to lesser tubercle. Now, lesser tubercle is rotating. It is moving in the front side to meet the origin point. That is exact opposite to teres minor, infraspinatus. Their origin point from the scapula on the back side. Okay. So they rotate externally or laterally. Here, the origin point from the subscapular fossa, that is in the front side. So what is the action? This muscle is helping for medial rotation. It is rotating inside, internally, to meet the origin point. So medial rotation of the shoulder joint is done by which muscle? Our teres minor muscle. Now, while doing medial rotation, the humerus bone also moves towards the body, and that is called adduction. So rotating inside, while rotating inside, the humerus bone also moves internally, moves towards the trunk. Okay. So adduction also takes place. So adduction and medial rotation. That's all about the subscapularis muscle. Okay. So now these four muscles, what are those? Your subscapularis muscle, supraspinatus, infraspinatus, and teres minor muscle. These four muscles are called rotator cuff muscles. What this muscle will do? They give stability to the shoulder joint. Okay. So mnemonic sits muscle, SITS, very old mnemonic. Supraspinatus, infraspinatus, teres minor, subscapularis. Okay. Now, out of these four muscle, the subscapularis muscle is called forgotten muscle. So out of the four rotator cuff muscle, the subscapularis is called forgotten muscle because muscle is very deep and the pathology is very difficult to localize. That is why we call subscapularis muscle as a forgotten muscle. Okay, right. Next, now we want to see one more muscle, one last muscle. Now our latissimus dorsi muscle. Now latissimus dorsi muscle, again, no need to know the exact origin point. Okay, just remember latissimus dorsi muscle origin from the trunk on the back side, posterior side. If you remember this, there is more than sufficient. Origin from the trunk on the back side. Okay. Now insertion. Insertion to humerus bone. Which part, sir? The floor of the intertubercular sulcus. Floor of the intertubercular sulcus. The lady between the two major. Yes. Intertubercular sulcus. Fine. Now what is the action? Now the humerus bone moving towards the trunk. Latissimus dorsi muscle from the trunk, insertion to the humerus bone, floor of the sulcus. Now, the humerus bone move towards the trunk. Humerus bone moving towards the body. So what is action? The action of latissimus dorsi muscle. Number one, adduction of the shoulder joint. Okay. While doing adduction, there is also medial rotation of the shoulder joint. Number three, now this muscle arising from the trunk on the back side. So this muscle, they do extension, extend the shoulder joint. The only difference between the pectoralis major and the latissimus dorsi, this one only. Pectoralis major muscle arising from the trunk on the front side. So pectoralis major muscle flex the trunk, whereas latissimus dorsi muscle from the trunk on the back side, that will extend the shoulder joint. Okay. So latissimus dorsi muscle having three actions: adduction, medial rotation, and the extension of the shoulder joint. Now, what is the nerve supply? Nerve supply of latissimus dorsi, thoracodorsal nerve. Thoracodorsal nerve, also known as nerve to latissimus dorsi. Okay, right. So we completed latissimus dorsi muscle. Now, one more small muscle we have in this diagram, teres major muscle. Now, teres major muscle origin. See, origin from scapula, which border? This is the lateral border. So this is lateral border. Okay. So origin from the lateral border of the scapula. Yes. What about the insertion? Insertion to medial lip of the intertuberculous sulcus. Medial lip of the intertuberculous sulcus. Intertuberculous sulcus. Next, what is the action of teres major muscle? Action is similar to subscapularis. What is the action of subscapularis? I told you adduction and medial rotation. In the same way, yes, the humerus bone, it is rotating towards the origin point like this. It is moving towards the origin point. So humerus bone moving towards the trunk. So adduction of the shoulder joint. Adduction of the shoulder joint, plus it is also rotating inside. Medial rotation of the shoulder joint. Okay, so two actions are there for the teres major muscle. One important thing is the nerve supply. Nerve supply of subscapularis. We have two nerve, upper subscapular nerve and the lower subscapular nerve. So the nerve, that is our upper subscapular nerve. Upper subscapular nerve. Okay, and this is our lower subscapular nerve. Lower subscapular nerve. Right. So our teres major is supplied by, see the diagram. It is supplied by which nerve? This nerve. What is that? Yes, our lower subscapular nerve. So teres major is supplied by lower subscapular nerve. Okay. So lower subscapular nerve supplies two muscles. Lower part of subscapularis and teres major muscle. So subscapularis, it is supplied by upper subscapular and the lower subscapular nerve. So subscapularis is the hybrid muscle. So subscapularis is a hybrid muscle having two nerve supply. Okay, right. So these are the points you have to know about the teres major muscle. Right. So now after finishing these muscles, now between these muscles we have some spaces. We have three space. One space is quadrangular shape and two triangular space. Okay, now see the diagram. Now this is the back side posterior view. We are seeing this muscle. This is supraspinatus above the spine. This is supraspinatus and deltoid we have removed, and this is our infraspinatus, and below that this is teres minor and this is teres major. Okay, and we are seeing the humerus bone. This is the greater tubercle of the humerus. Okay, and this is the neck of the humerus. So this is the shaft of the humerus, plus we are seeing triceps muscle. Now this is the long head of triceps muscle and this is the lateral head of triceps muscle. So these two are the heads of triceps, long and lateral head of triceps. Right. Now see the diagram. In the diagram, yes, first we're going to discuss about the quadrangular space. So having four sides, above, below, medial, lateral. Now superiorly, we have which muscle? Teres minor. Inferiorly, teres major. Medially, long head of triceps. Laterally, neck of humerus bone. Very simple. So please write the quadrangular space. We're going to write the boundaries of quadrangular space. So quadrangular space boundaries, above we have teres minor muscle. Now in the front side, we have subscapularis plus capsule of the shoulder joint. Capsule of the shoulder joint above. Below, teres major muscle. Okay. Medially, long head of triceps. Long head of triceps. Okay. Laterally, neck of the humerus. Right. Now we have one nerve and one artery passes through this space. Now contents are, number one, nerve, axillary nerve. Artery, posterior circumflex humeral artery. Posterior circumflex humeral artery. Okay. So we have two contents, axillary nerve and posterior circumflex humeral artery. So two structures passes through the quadrangular space. So now we're going to see two triangular spaces. Now one is called triangular interval and another one is called triangular space. Okay. So that's all about the quadrangular space. Now we're going to see triangular interval. Triangular interval. Now triangular interval boundaries are, now this is above. I'm writing A here. This is above. And this is medial side. And this is lateral side. Now above triangular interval, what is superior boundary? Muscle, which muscle? That is our teres major muscle. So above teres major muscle. Okay, fine. Now what is on the medial side? Medially, long head of triceps muscle. Triceps muscle, long head. Okay. What of the lateral boundary? Below the neck, we have shaft. Shaft of the humerus bone. Fine. Next, what are structures passing through this space? The structures passing through this space are radial nerve, and profunda brachii artery. These two structures passing through this space, profunda brachii artery. Okay. So two structures passing through this triangular interval. Right. Next, your triangular space. See the diagram. Triangular space is diagonally opposite. Now again, this is above. I erase all this. Now this is above. This is below. And this is base. This is forming the base. Now above. So TS means triangular space. Now triangular space above, we have teres minor muscle. Okay. Below, teres major muscle. Okay. Now who is forming the base? Base is formed by long head of triceps. Long head of triceps. Very good. Is there any structure passing through this triangular space? Yes. One artery will pass. Is there any structure passing through this space? Yes. Only one structure passing through this space. That is our circumflex scapular artery. Circumflex scapular vessels passing through the triangular space. Okay. Right. So that's all about the spaces around the shoulder joint. So in the exams, they may ask you the content or they can mark any of these spaces and they'll ask you structure passing through, identify. Yes, anything can be given. So now we're going to see the muscles of pectoral region. Now first and foremost muscle, yes, that is our pectoralis major muscle. Okay. Now we're going to remove the skin on fascia so that we can see the pectoralis major muscle clearly. Origin is not important, is coming from clavicle, sternum and the costal cartilage. So leave that. Now see the insertion. Now inserted to the, yes, the lateral lip of the intertubercular sulcus. Okay. Right. Now what is the action of our pectoralis major muscle? Pectoralis major muscle will do three action. Number one, flexion of the shoulder joint. Flexion. It is doing the flexion. Shoulder joint is flexion. Flexion. Now the muscle is arising from the trunk and going to the humerus. So the trunk, the shoulder joint is moving towards the trunk. It is moving towards the trunk. That is the adduction and also the medial rotation. See, shoulder joint is adducted and it is medially rotated. So three actions are there for our pectoralis major muscle. Number one, flexion. Number two, adduction. Number three, medial rotation. So these three are the actions of our pectoralis major muscle. Now we remove the pectoralis major muscle and we are seeing the pectoralis minor muscle. This is pectoralis minor muscle. Now pectoralis minor muscle, yes, attached to the, yes, see here, coracoid process, origin from the third, fourth and fifth rib. Now see the action of pectoralis minor muscle. Pectoralis minor muscle, along with serratus anterior, it is moving the scapula in the front side. So protraction of the scapula. Okay, right. Now next, we are seeing the serratus anterior muscle. Again action, same thing only, along with pectoralis minor, protraction of the scapula. One more action is there, overhead abduction, along with trapezius muscle for serratus anterior. We will see that later. Right. Now here we are seeing the deltoid muscle, three heads. The anterior fibers, middle fibers. This is anterior fiber, this is a middle fiber, and this is the posterior fiber. So we have three fibers. Now we remove the deltoid muscle so that we are seeing the, yes, the supraspinatus muscle, and that is the infraspinatus muscle, and below that, that is our teres minor muscle. Supraspinatus above, infraspinatus, and just below that, there is our teres minor muscle. Okay, right. So now in the front, we have one more muscle called subscapularis muscle. Now see the insert subscapularis muscle to the lesser tubercle. You are seeing that. Now supraspinatus, infraspinatus, teres minor, and the subscapularis muscle, these four muscles, what they will do? They are forming the rotator cuff muscles. Very good. Supraspinatus, infraspinatus, teres minor, and our subscapularis muscle. Right. So now we remove the supraspinatus and infraspinatus muscle. So we are seeing some spaces here between teres major, teres minor, the humerus bone, and the long head of triceps. That is a quadrangular space. This is a triangular interval, and we also have triangular space. We know the boundaries of these spaces. We discussed about these spaces. So I'm not saying the boundary again. I'll say the content. Now what's the content of the, what is structure passing through quadrangular space? The quadrangular space, axillary nerve and one artery, posterior circumflex humeral vessels. This is a triangular interval. Who is passing through triangular interval? Radial nerve, very good, and profunda brachii artery, very good. Now upper triangular space or triangular space, circumflex scapular vessels. These are the structures passing through these spaces in the scapula. Now last thing, now we're going to see the axilla. So axilla boundaries, yes, we're going to discuss. And then we can start the brachial plexus. Okay. Now what is axilla? See, axilla is nothing but it is one small space. Now all the neurovascular structures to the upper limb, they're coming from neck only. So neurovascular structures from the neck, they go to upper limb via axilla. So that is why axilla boundaries very important. So boundaries of axilla, yes. So axilla is nothing but it is a space through which the neurovascular structures, from the neck, neurovascular contents from the neck reach upper limb. So all the neurovascular structures from the neck, they are reaching the upper limb via axilla only. Now what are the boundaries? Front, back side, anterior wall, posterior wall, medial wall, lateral wall, apex and base. So now we're going to see these boundaries one by one. Next, apex of the axilla. See, apex of the axilla is nothing but it is the junction between the neck and the axilla, that is called cervico-axillary canal. Cervico-axillary canal. Now we're going to zoom this region to see the cervico-axillary canal or apex of the axilla. Now the cervico-axillary canal, in the front side, we have which bone? Clavicle. This is clavicle anteriorly. Okay, this is anterior. Now behind, posteriorly, we are seeing the superior border of scapula here. Posteriorly, we are seeing the superior border of scapula, Anteriorly, clavicle. Okay, medially, you are seeing this bone. What bone? First rib. So medially, yes, we have first rib. First rib on the medial side. So that's all about the apex, cervico-axillary canal. Now we're going to take the cut section. So in the cut section, yes, this is anterior, this is posterior, this is medial, and this is lateral. Okay. Now anteriorly, we have the chest region, pectoral region, and we have two muscles. Anterior wall is formed by, yes, pectoralis major and the pectoralis minor muscle in the front side. Back side, posteriorly, we have subscapularis, teres major, and latissimus dorsi muscle. See these three muscles forming the posterior wall of the axilla: subscapularis, teres major, and the latissimus dorsi muscle. Okay. Now what about the medial side? Medial side we have a trunk, rib, no? So medial side, yes, we have a rib. Now from the rib, we have one muscle taking origin, that is our serratus anterior, plus one nerve is running over the serratus anterior muscle, that is our long thoracic nerve. Long thoracic nerve. So the medial wall of the axilla is formed by serratus anterior muscle, ribs, and the long thoracic nerve. Now laterally, yes, we have intertubercular sulcus of the humerus bone. So round structure, there is a humerus bone, and you see the sulcus, intertubercular sulcus. So these are the four walls of the axilla, right? Now what about the contents? Now the contents are, so please write. Now axillary artery. Okay. Number 2, axillary vein. Number 3, cords of brachial plexus. Cords of brachial plexus and its branches. Okay. Number 4, long thoracic nerve. Long thoracic nerve. Fine. And then axillary node. And then axillary tail of Spence, the extension of breast. Axillary tail of Spence. Plus, you also have some fat. These are the contents of the axilla. Okay. So right. So these are the contents of the axilla.